Welcome to GovInsider Live Studios. I'm Joshua Chambers, the founder of GovInsider, and today we're bringing you a brilliant global innovator from across the world. She is the Undersecretary-General of the United Nations, the Executive Secretary of the United Nations Economic and Social Commission for Asia and the Pacific, and prior to this, she was an Indonesian cabinet minister. Joining us is Professor Armida Alisjahbana. Welcome, Madam Undersecretary-General.
Thank you very much. My pleasure to join the conversation.
Your organisation, UNESCAP, has looked at how COVID-19 will economically impact the poorest in society. Give it to us straight. How bad could this be for the developing world?
Yes, I'm sure you've also been following this situation very closely. The impact is unprecedented. Because again, it's not only health crisis, humanitarian crisis, but immediately impact the economy or the socio economy, the lives of everybody across the board, and especially for the poor and the vulnerable. They would be impacted the most, because literally they cannot, they do not have anything. They do not have enough saving. They do not have, spare capacity and so on. Yes, so literally, this is, I think, unprecedented.
And your colleagues have in particular pointed to the problems being caused by medical export bans, and they've called for something called do no harm trade policies. What are these, and how could these at least help some of these developing nations?
Yes, several countries have been impacted significantly, especially because of the healthcare systems are overstretched, and several of the medical supplies, the mask, the ventilator, and so on and so forth, they could not provide by themselves, right? They do not have in stock. They cannot produce quickly. So therefore, very necessary to have this flow of essential medical supplies as well as essential goods, to be able to flow through the countries. But again, unfortunately, this does not happen. Because why? Because countries close their borders across the board. Again, across the board, people, traffic, as well as the flow of these essential medical supplies, including that.
We are live on Facebook Live, so if you have comments or questions, please put those comments in the section below. Please share this feed, and members of UNESCAP will be replying to those questions as we're having this conversation as well. Clearly, countries that are hoarding medical supplies is going to be a great issue for the poorest in Asia. What can the United Nations do about this, and what are you calling on nations to do about this?
Yes, we are, of course, not ourselves. This is being coordinated by our headquarters. We are preparing in various pillars. Again, the health support, the healthcare support, which is coordinated by WHO, and then the socio-economic response and support. This is directly coordinated by New York. But then the support is to countries directly, especially to the least developed and as well as middle-income countries. So, but we are still in our preparation, and we are mobilizing our resources, including additional resources. For example,
please.
Yes. For example, again, from the policy support, including also a support at the ground level, because several of our colleagues from agencies can support also at the ground level. Policy support, for example, in devising a government on how to have a targeted fiscal stimulus, which is very important. If you want to help the poor, the vulnerable groups, how you can have an effective stimulus, what kind of stimulus, how much, and so on. So this is more on the advocacy policy support. That's one. And second is the more direct support, but that one is being coordinated by WHO.
And your organization, UNESCAP, has noted that in Asia, social spending on the poor is very low. It's very low. And you're calling on nations to be doing more. What is the United Nations actually saying that countries should be doing at this moment to support the poorest in society and help them get through COVID-19?
Again, a social security system is very important. Why? Because, but I think this has to also go together, with the healthcare system. Healthcare system, the basic healthcare system. This has to go together. Again, now what we see, countries with adequate or sufficient or good, healthcare system are also better able to cope with the crisis. Yes, and then countries that have fragmented healthcare system are also the less able, right? So, but then how also the relationship within the social security system and healthcare system, because like the health insurance, the universal coverage is part of the social security system. And again,
so sorry to interrupt, ma'am, but are we saying that nations should be looking to put in place universal healthcare coverage for their poorest?
Right. Yes, right. And again, countries in Asia Pacific, many countries, about not only countries but population-wise, about 60% of the Asia Pacific population still lack access to this social security system or social protection. So then they become very vulnerable in this situation.
And what can the international community do to support the poor as well? What can international institutions be doing right now to assist?
Yes, again, this is because unprecedented time, very challenging. Everybody, right? Have been impacted significantly. Again, we cannot only address the socio-economic impact. Likewise, we cannot only address the healthcare impact, or the health crisis. Has to be both. We cannot only address, again, the epicenter now in Europe and US, but we also have to start, preventing, including countries that to emerge or to escalate, as well as the countries, including developing countries, that are seeing the impact as escalating. So has to be all. So therefore needs also support, especially for developing countries. Because otherwise this will be I don't want to say it, but this will be a very big humanitarian crisis.
Yes, indeed. And if people watching at home have more comments, please keep them coming in Facebook Live, and do feel free to share the stream on your profiles as well. The United Nations has been criticised a great deal over the past few years by various world leaders and others as well. Is this its moment to prove the value of international institutions and global coordinating bodies?
Yes, of course. The UN has been focusing on saving lives and building resilience against future or ongoing shocks. And to do this, we need a large-scale, coordinated, and integrated, comprehensive, across countries response. It's not about one or two countries. So the role for UN is very clear. So how to coordinate, for example, again, the healthcare response, to suppress transmission and the one for sure. And then to support the global humanitarian response, to support millions of people on the world's poorest countries who are least able to protect themselves. And then not to mention how also to mitigate the socio-economic impact of this crisis by focusing the most vulnerable, the women, the youth, low-wage workers, the SME, small and medium enterprise, informal sector, especially those in humanitarian and conflict areas. And then us, ESCAP in Asia Pacific is also how, again, our focus is especially coming out of this crisis and to mitigate future and crisis and to prepare us better is how to strengthen the healthcare system and social protection. Again,
and I'm sure many people watching are actually potentially from the United Nations or have worked with the United Nations in some way. So I'm curious actually how you as a leader of an international body are helping your staff to adapt to this difficult time and how the UN itself is adapting to working completely remotely and all of these other things that the rest of us are doing as well.
But we are fortunate again because of technology. We've been working actually quite a lot with virtual modalities because we also interact with many countries in the region. We coordinate with New York, we coordinate with colleagues from other regions and so on and so forth. So we are quite prepared and of course it's a bit difficult because we do not have the mobility, right, physical mobility, but again we try our best. Everybody is quite now well adjusted in the situation. They work from home and using various like Skype and so on, right, that we coordinate our work. So far we manage quite well.
And do you have any message for your United Nations staff who are, of course, as all of us are, worried about their lives, their livelihoods, their families? Do you have anything to say to them?
Sure. Again, we first and foremost, our priority is to ensure the safety of everybody. Certainly our staff, the safety and health of everybody, and certainly staffs and their dependents. That's first and foremost. And second, there is always a silver lining in any situation. In this case, this is also a good opportunity on how we transform the way we work. Less carbon footprint, for example, of course, less travel, right, less physical presence in meeting and so on, to be able to work more efficiently using this technology again. And then this is an opportunity to transform the way we work, the so-called digital workplace. So if we can do this and take this opportunity, then I think there is some benefit. Again, in this unfortunate situation. That's one side, of course. That's one side.
Yes. And let's talk a little bit now about you. You're a woman from a developing nation in a traditionally male, Western-dominated international system, and I think your leadership itself is quite an interesting and inspiring story. I wondered, when you go to work and run the United Nations in Asia every day, how do you reflect on your personal experiences and story, and how does that affect the way that you do your work?
Well, again, we take this as a privilege, of course, as an honor to serve in the United Nations. Well, my background is a civil servant. Again, you serve and also do your best. Second, always also do improvement, or one of our motto is continuous improvement wherever you are. Wherever you are assigned to do your best and continuous improvement, and regardless, right? And then, of course, treat your peer, your colleagues, and so on with respect and fairness. So basically that, and also how to promote this gender equality in the jobs, But then you need to balance actually, gender equality, gender parity, but also with meritocracy. You need to balance both.
And to the women, particularly in the developing world, who are watching this now live, do you have any advice for them or any message for them?
Well, there is always opportunity out there, yeah. So again, just do your best, be professional, and you need also to be firm, yeah, on your integrity. Integrity meaning personal and professional integrity. So basically that, yeah.
Great advice. And Madam Undersecretary-General, let's just finish off with some reasons to be cheerful. What innovations, what new developments are exciting you in the world at the moment?
Oh, again, we live in Asia Pacific, yeah. We as GovInsider, we live in Asia Pacific. This is the region which offers opportunity. Challenges, for sure, there are many challenges, yeah. Unfortunately, if we have certain challenges, it comes most often from our region, yeah. Again, for example, climate change, yeah. Half of the emission comes from our region, but potential solution also comes from our region. Why? Because technology, yeah. Leaders of technology are here. Population, many of the countries have young population, and rapid progress, yeah. Rapid progress in socio-economic dimension as well. Yeah, so these are the assets. Yeah, so I'm very thrilled. I'm very, how do you say it? Yeah. Yeah, very encouraged with what's going on. But again, because of COVID-19, this is our biggest challenge and test. But again, I would like very much that the region comes with solution and contribution to end the pandemic and how to recover better. Recover better meaning, as Secretary-General of UN said, recover better meaning more inclusive and more sustainable.
Madam Undersecretary-General, thank you so much for joining us today. To those who are watching at home, please keep your comments coming on Facebook Live for the next 3 minutes, and we'll endeavour to answer as many as possible. But it's been a real pleasure and an honour to speak with you today.
Thank you very much, Joshua. Thank you very much. Thank you very much to all. Thank you.
Thank you.